Mm. Hi, everybody. I'm so sorry about that. I don't actually know what happened, but my phone just completely shut down. So sorry, everybody. Thanks, Dr. Sulaiman, that you're still here. My phone actually just Hi. Hi, Dr. Sulaiman. I'm so sorry about that. I don't know what happened, but my phone just completely shut down. I'm sweating from being so trying to get it sorted now. I've actually had to use another phone quickly.
Oh no.
But thank you for staying on.
Oh dear.
It's just a bit.
That's
Yes,
very stressful.
sure. I'm so glad you stayed on. Thank you very much. And I'm just hoping that everyone's coming back. So sorry about that, guys. Just had a technical error with my phone shutting down for some reason. So we were busy with what treatments are available for couples struggling to conceive.
Yeah, I'm not
That was
sure
our
now.
question.
Yeah, I'm not sure what everybody heard until the video stopped, because I was speaking about
Yeah.
two types of treatment basically. We've got the treatment
Okay.
where we can try to fix the problem, or we can try to do what we call assisted reproduction. And assisted reproduction, that's, I think everybody thinks, oh, if you go to the fertility clinic, you must do IVF. But that's not always
Yeah.
true, because very often we can just fix the problem. So a typical problem is, for instance, endometriosis. So if a woman has endometriosis and she has very painful periods and she has been trying to conceive for 2 years and she's got a husband with a normal sperm count, we can fix the endometriosis. That means we can do an operation, which is called a laparoscopy. It's a minimal invasive surgery, and we can remove the endometriosis. And it can be quite satisfying, because a lot of women, where we remove endometriosis, they can conceive spontaneously at home without my help. We just do the operation, that's it. Or we come back to the fibroids. There's a fibroid in the wrong spot. We remove the fibroid. The symptoms of excessive bleeding, they improve, but also the woman can conceive spontaneously. Or like I saw this morning, a woman had scar tissue in the uterus. I removed the scar tissue a few months ago. She conceived immediately afterwards, and this morning I could happily see the baby and sent her off to a gynecologist. So that was, I mean, these are these things. So surgical correction of female fertility problems is quite common, okay? And very often we can fix it by surgery, okay? Not necessarily by surgery, but by surgery. And then she can conceive afterwards. And then we can do what we call ovulation induction, or giving medical treatment for ovulation problems. So polycystic ovarian syndrome or thyroid problems are very easily to treat with medication. So you've got, for instance, an underactive thyroid, which is not uncommon in women, which can lead to ovulation problems. We can treat that with thyroid hormone, and that restores normal ovulation. And these women very often can conceive without further problems. And then the biggie is obviously polycystic ovaries. And I have so many women that come to my office and say, Doctor, I've got polycystic ovarian syndrome, and it's so bad, and it's so bad. It's actually a good diagnosis from a fertility point of view, because we can help most women with polycystic ovarian syndrome without doing IVF. So most women with polycystic ovarian syndrome, we can give medication to help the polycystic ovarian syndrome, or to make them ovulate, and we don't have to do IVF. We just make them ovulate. The tubes are fine in the majority of the cases. Let's hope she's got a husband with a normal sperm count. We make her ovulate, say, okay, you ovulate now, you can have sexual intercourse, and most women will conceive without doing IVF who have polycystic ovarian syndrome. So it's a better diagnosis to have than, for instance, a husband with a very low sperm count, or blocked fallopian tubes, or severe endometriosis, because these diagnoses usually require big treatments. It's not so easy. Polycystic ovarian syndrome, yes, sometimes we also need big treatment, but usually not. Usually we can get away with relatively straightforward treatment with just fertility tablets that have to be taken a few days per month. So we
Okay.
can do fixing of the cause, okay? We can do restoration of ovulation, make a woman ovulate, or we can fix the problem. If there is endometriosis or a fibroid or a blocked tube or something that we can, or a polyp, we can fix it. Or then the other option, the other treatment option is called assisted reproduction. And assisted reproduction, you got two common ones. The one is artificial insemination, and the other one is IVF. And it's similar, but artificial insemination is easy, it's cheap, it's non-invasive, and IVF, it's a lot of work, it's a lot more money, and it's a small operation that must be done.
Yeah.
But the IVF, it's always our ultimate one, and that's the one. If we can't get it right with other treatments, or if there is a big problem, most women end up with doing IVF. So I give an example. Say if a couple comes in my office and they say they have been trying to conceive for the last 10 years, probably going to end with IVF, whatever the diagnosis, is. So it's a big problem. We have a big solution, and that's IVF. And IVF is possible in most cases, not always, but in most cases. So that's our final solution that we can offer. If the tubes are blocked, if there is a bad endometriosis, if the husband's sperm count is very bad, doesn't matter. We can do IVF. We can do IVF as long as we've got three things. We need sperm. And these days, one sperm cell is enough. Huh? So if a guy has got a very low sperm count, that's okay. That's fine. We can help. We need eggs, and we need the uterus. The uterus, that's also usually not a problem, because very often there are problems of the uterus, but we can fix it. Okay? There's a polyp in the uterus, I can take the polyp out. There is scar tissue in the uterus, I can remove the scar tissue. There are fibroids, I can fix the fibroids, I can remove the fibroids. So the uterus we can nearly always fix. The big problem is the eggs. That's the big problem. Because a woman is born with a certain amount of eggs. It's not like a man. Huh? A man makes millions of sperm cells every day. But a woman is born with a certain amount of eggs. And I always tell to my patients, you must visualize it, the story of the egg basket. I say, when you are in your puberty, you're given an amount of eggs. It's a basket full of eggs. Look at it, okay? And that's what it is, okay? And that basket gets smaller every month. If you're pregnant or not, or if you take birth control or not, or doesn't matter, it just gets smaller. So if a woman has got good eggs, we've got a good success rate with IVF. If a woman has got bad eggs, we've got bad success rate with IVF. So now I also always tell to my patients, you must compare it to buying a house. Huh? Well, because if you buy a house, you look at the estate agency, always you must look at location, location, and location. And if you do IVF, the success rate depends on the egg, and the egg. So I exaggerate a little bit because obviously other factors are also important. But egg quality is crucial for the success rate of any fertility treatment. And then women ask me, doctor, how can I test my egg quality? That's the easiest question if you ask how old you are. It sounds very cruel, but that's what it is. Huh? So that's the reality. Huh? So there are a lot of other things that we can do. But if you say you're 28, well, probably got very good eggs. If you're 48, you've got very bad eggs. It's virtually guaranteed. Huh? Okay, so that's basically the bottom line. And yes, there are other tests that can be done, blood test, ultrasound. We can take out the egg and have a look with it with a microscope, but age is a very good predictor of egg quality. So for treatment options, we can fix, which I always try to do first. You can see, is it possible to fix? Okay. And if that's not possible, then we have to go to assisted reproduction, or the easy one, artificial insemination, or the bigger one, the in vitro fertilization, and our IVF. That's like our ultimate thingy, and we do like 100 cases every month. So it's a very common treatment, and it's a very satisfying treatment because we've got every day virtually pregnancies with IVF. So it's a wonderful thing that we can do. Yes, it's a miracle.
I actually, because I know a lot of women are going to actually watch the video afterwards. So if you don't mind, I'm just going to run through quickly from the top. Saying our first question was, when should a couple seek medical attention for fertility from a fertility specialist? And we said, you mentioned, doctor, that if it's under 35, it is under 35, it's already past a year. And then if it's under 35, sorry, if it's over 35, then it's 6 months. Am I right?
Yes, that's correct. Yes. Yeah.
And then
For
what factors
for younger
influence
women,
female?
1 year. Yeah. Yeah. Sorry. Yes.
For
Carry
yes,
on.
for young women, 1 year study. And then what factors influence female fertility? And that was obviously the age, and it was PCOS. I think you mentioned the 4 things: PCOS, endometriosis, and fibroids. And then the third question was, what factors influence male fertility? And you mentioned semen, right? It's obviously the sperm quality. And then what we did say to women is that what we did say mention is that we should actually make sure that you try to use the Mediterranean diet. That is what I remember. Am I right?
Yeah. Well,
The Mediterranean diet
is the best diet. Yes. Yeah.
Yeah. So, and then you said the test that you undergo would, for your first appointment at the fertility clinic would be the blood tests, the semen analysis, the do I remember
Yes.
the blood test,
And
semen analysis,
ultrasound of the
HSG.
ovaries. Yeah. The ultrasound. Okay. The scan, and maybe the X-ray of the fallopian tubes, which is called the
Yes,
hysterosalpingogram. Okay.
that's correct. That's correct. And then we just mentioned the treatments that's available for patients that's struggling to conceive. And then we've got one last question before we go to the quick questions we're going to go through from our viewers is, how does the COVID affect, the taking the COVID-19 vaccine, and how does COVID itself affect anyone that's trying to conceive?
Yeah, it's a good question. So we know for sure that COVID is bad for pregnancy. Huh? There is more and more evidence that pregnant women, they suffer from more serious COVID symptoms than non-pregnant women. And I mean, to put it very clear, COVID can kill moms and babies. Huh? So it's very important that women understand that COVID is bad. Now, it seems to get better now with the Omicron. So it's not as bad as it was 6 months ago or a year ago. And it was really bad. Now it's getting much better. Yeah. So the vaccine is safe. It's effective. It reduces the chance of having severe disease. It reduces the chance of hospitalization. It reduces the chance of death for moms and babies. There's no doubt about that. It's safe. It does not cause miscarriages and does not cause problems. The vaccine is safe even in pregnancy. Huh? So it's strongly recommended by all fertility societies and all obstetric societies in the world for pregnant women to be vaccinated before or during pregnancy. There's no doubt about that. I would like to stress that if you care about your baby, make sure you're vaccinated. It's very, very important. Yeah.
Okay.
Obviously, it's something we are faced with the COVID vaccine, so we have to, with the COVID disease, we have to deal with it. At this stage, everybody is still checked before any procedure is done. But I'm pretty sure within the next few months, the guidelines will maybe start changing, and COVID becomes more like an endemic disease, and the worst seems to me, hopefully, I think that's what I think is going to be over hopefully soon, but we'll see.
Yeah. We absolutely hope so. I think there's 1 or 2 questions here. The pulse supplement. Okay. So one of the questions I saw earlier from someone was them asking what they've gone through cancer treatment, radiation, and are they still able to conceive? Or is it something that you'd have to do extra tests for or something?
You have to test, yeah. So if you cancer treatment, that can cause an effect on the eggs. So we have to test it. So a woman like that should come in. We can scan the ovaries. We can do the blood test to check the ovarian reserve and see if she can still conceive, yes or no. So that's common. So what a lot of women do now before cancer treatment, they freeze their eggs. So to make sure that they've got eggs after chemotherapy for cancer. So it's a common thing that we do now on every month we do that. So, but yes, we can check it, and sometimes the chemotherapy has no effect on the fertility. Sometimes it can destroy the ovaries completely, but we can check it. It's not a problem. So she must have an appointment. And that's also another question was somebody asked about a testis biopsy, TZ, if that's done by the urologist or it can be done by the fertility doctor. We do it ourselves, so we don't have to go to a urologist for that. We can do it ourselves. We can just. We do also operations on guys, so.
Oh, okay, that's great.
Yeah.
Then we've got another question. It's about can you give me more information about the intralipid drips during IVF procedure?
Yeah, intralipid doesn't work. It's a good question.
Okay.
Yeah, doesn't work. Yeah, the evidence is quite clear. It doesn't make any difference. Yeah. So not recommended. Yeah. Okay,
and then somebody asked, can someone with PCOS have IVF? And doctor said earlier, it's like he loves getting patients with PCOS. It's like the easiest.
Yeah, so women with PCOS usually don't need IVF unless it's a very stubborn PCOS, but more commonly if there is anything else. For instance, I give an example. The husband has got not a great sperm count, yes, and then we very often end doing IVF.
Okay, there's one more question. I see it's about PCOS. I have PCOS. My doctor suggested folate tablet, and I've been using it for some time with no luck. But before you answer that, doctor, I'm always hearing recommendations not for the folic acid or the folate, more for the metformin.
Metformin is good, yes.
Glucofage. Is it something that you would rather recommend for someone with PCOS?
Yeah, there are supplements like metformin and inositol that both seem to be about equally effective for polycystic ovarian syndrome, and they're certainly useful both for the underlying treatment of polycystic ovarian syndrome. It's not always effective, and many women will need to use a fertility drug. So the folate, I mean, obviously, if you use folate, it's fine. It's good for, I mean, if you try to conceive, but it will not make you ovulate in most cases. You will need something like an ovulation induction treatment with something which is called letrozole or Femara or Clomid or something like that. So women with polycystic ovarian syndrome, they can use metformin, they can use inositol, they can use other, definitely they should use folic acid. But they require very often a fertility drug to make them ovulate. But the best treatment and as effective as metformin or inositol is losing weight. So we know that if you lose weight, the chance of conceiving is certainly increased with polycystic ovarian syndrome.
Okay. Can we ask the last question? Do you mind? So hubby says this. Okay, so she's been trying for 3 years and doctor said she's fine. And husband has average sperm, still no luck. What would you recommend they do?
They must go and see a fertility doctor urgently.
Okay, absolutely.
Because there's certainly something else going on.
Yeah. Are there supplements for low sperm count?
Yes.
But like you said again, the health, what you eat, eh?
Yes. I mean, it's more important to have a healthy lifestyle than to take supplements. But yes, there are supplements on the markets that are available that can have a small effect on sperm quality. Yeah.
Okay. Then we've got, can someone with 1 tube fall pregnant conceive? Age is 38.
Yes, depends obviously on the quality of the other fallopian tube. So somebody like that, she's 38 with 1 tube, she should go and see a fertility doctor. The other tube should be checked as a matter of urgency to make sure it's fine. And then what I usually do is just give them fertility drugs to increase ovulation, that hopefully she will ovulate on both sides. And then she might conceive quickly, yeah.
Okay, perfect.
What are the chances of
They are
IVF success after sperm retrieval through TZ? That's fine, is the same as with normal IVF for any other indication. It just depends on the quality of the eggs. Huh? So I've got a young woman, she's 28 years old, and we've got a husband, we have to do surgical sperm retrieval. She's got a good chance of success. If we have got the same problem in somebody's 43, the success rate is good. Depends on egg quality. So the success rate with testicle sperm is similar as for any other indication of IVF.
okay, perfect. Thank you very much, Dr. Helen. And I'm seeing some people just saying thank you to you for
Yeah,
you making your patients feel comfortable. And we thank you for that.
yeah.
And
You're
if
welcome.
anyone has any, it's a
Yeah,
pleasure. If anyone has any questions for Dr. Helen, you can pop them an email. You can go to their website, Cape Fertility website, where they've also got a listing on on fertility solutions. And you can also email him. Your email address, Dr. Helen?
yeah. I always say to the patients after the consultation, I say, don't call me, email me, yeah, because I'm always busy and
Yes,
it's very difficult to reply on the phone.
yes,
But email is great, and I reply quickly. It's
yes.
Helen, Sheylen, okay, Sulaiman Helen, Sheylen at capefertility.co.za. If you go to our website and you go to contacts, you see the different doctors over there. Also, you can just click on the doctors, and you also see there are specific email addresses of myself, but also the other fertility doctors that are with me in the clinic, Dr. Leroux, Dr. Mata BC, and Dr. Oosthuizen. Huh? All very nice doctors.
Awesome. Yes. Thank you very much again. Sorry about the little technical hitch earlier on.
Yeah.
But thank you very much, Doctor. And
Always
it's
a
great
pleasure to
talking
help
to you
you.
as always.
Yeah. And thanks for
Thank
thanks
you.
for your good work also. You take care.
Thank you, Dr. Helen.
Bye
Bye.
bye.
Thank you, every one of you, for joining us this evening. Yeah, Dr. Helen is such a great guy. And thank you, everyone watching from the UK. Oh, that's a nice message. Forever grateful to Dr. Helen for my miracle baby. It's so great to hear such amazing stories. Everyone recommending you and saying thank you, Dr. Helen. So, guys, as I said, it's 2022, and thank you everybody for joining us. We'll back next week and Wednesday evening again, and then we also do the talks on a Friday over on our Facebook page. So have a great evening and see you guys soon. Bye.